Well, good afternoon or morning, depending on what time of the day you are accessing the video. After the first few weeks of class, you should now have a nice accumulation of some very basic prefixes, suffixes, and the word roots. It's important that you know that this is just a very short beginning to what you're going to add many things to as we start to get into the body systems. We're always going to be referring back to a lot of these very basic word parts, so hopefully you've done your part of this and you have learned those basics in the first couple of weeks. I provided those two short videos to you that were some great videos that went over some of those basic word parts. I told you that those were not me. That was someone who calls herself the Penguin Professor, but I think she does an excellent job with all of her videos, and so I have patterned a lot of the things I do after what I liked about the videos that she did. So I just let her do those first two for you because she had done them so well. I want to refer you to those word part boxes that are in your textbook. I believe on pages, look on page 11, 23, 26, 27. These are your basics. You really need to know those. Let's move on and talk just a little bit about the integumentary system. So some of the word parts that we have been using or prefixes, and some of the word parts in some of those prefixes indicated direction. So I want you to please review these because a lot of these really pertain to the integumentary system. We use them when we're talking about the skin. There's a chart in your textbook that goes over those particular ones for you. You also learned some word parts that related to color. Color is also something that is very important when we're talking about skin. A lot of the words that you'll see will have some of those word parts that relate to color, so very important that you also know those. There are some very common suffixes. There's a few that you're going to need to know. We're going to get into those here in just a second. But all those basic things that you learned in the first few weeks, you must know now or you're going to be absolutely lost. So hopefully you've done your part, you're keeping up, and you're doing all those exercises using your resources in that the textbook provides for you, and you're doing well with all of this. Okay, so the first word parts that I want us to talk about specifically related to the integumentary system. There's a few word parts that are there in a chart for you here, and some of those are directly related to just the integumentary system. Things like derm, dermat, cutane. All three of those things, and it's three different ones, they mean skin. And you can look at this list. I'm not going to read them all off for you. A lot of students make a mistake when they're learning medical terminology that they think that they can memorize every word as it appears, meaning memorize what it is, how to spell it, and how it is used in in medical terminology. That might work for a short while, but it is really not the way for you to learn medical terminology. What you've got to do is you've got to memorize those word parts. I can't repeat that enough. I know I've said it, I've written it, it's everywhere, but you really have to memorize the word parts because once you know the word parts, you can put those into effect in any body system. You can look at any word, even a word that you have no idea what it is. If you know a word part or you can separate out your word parts, you're going to know something about that word, and it's going to give you a lot of help and a lot of clues as to exactly what the word means. All right, so moving on to some of the disorders of the skin. Dermatitis. Derm, I told you was skin. Itis, you already know, means inflammation of. So dermatitis, when we look at that word, it just means inflammation of the skin. And really, what does that tell us? Not really a lot. When I'm thinking about in the medical profession, anything from a fine rash to someone having an infection can be inflammation of the skin. So dermatitis is a term that incorporates a lot of things that could fit into that. So you should be reading the content in each chapter and then looking through the boxes that have complete words. There's a nice chart on page 100 in your book. These are all the disease disorders of the skin. Note that they're all in a list, have a word part from the list I gave above in my notes. in combination with parts that you already have covered. So see, we're not going to continue to reiterate the word parts that you have been expected to learn from the beginning. You have to take all of this information with you and then put it together. The exercises in the book will help you to kind of test yourself to see if you truly understand what you have studied and if you know how to be able to actually implement and use those word parts. Also, if you're having problems with mastering word parts from these lists, I'd recommend that you get some note cards and make yourself some flashcards. Some of the textbooks, I believe, come with a flashcard set. Perfectly fine to use those. If you've bought a used book, you probably did not get that set. So you can make your own flashcards. My point is, find what works for you and use it. As with most languages, none are perfect and none follow all the rules. So there are many skin terms that contain partial word parts or some words that don't contain any kind of word part at all. So those are the words that you need to reserve for having to memorize them. If it's not a word part and you can kind of pick it apart to figure it out, then you really are going to have to just memorize those particular things. All right, so let's talk a little bit about lesions, skin lesions. Skin lesions, and there's lots of them, and there's some really good pictures in your textbook, and I'll try to put some up here for you as well. But we have some general descriptive types of lesions. Those would be the macule, the plaque, the bulla, a papule, a nodule, pustule, vesicle, wheal, fissure, ulcer, cyst, nevus. Then we have some injury type lesions. I'll divide them. I'm kind of trying to separate them out. All right, so the injury type lesions, those are things like abrasion, contusion, incision, laceration, avulsion, and excision. So we've got two different types of lesions, two totally different types of lesions, but they all fit under skin or integumentary system skin lesions. All right, so infection-related lesions, abscess, acne, furuncle, cellulitis, impetigo, herpes, pediculosis, scabies. Those just a few examples of some of the infection-related lesions of the skin. Okay, so a few more, candidiasis, which is a yeast infection. I guess I should mention that there too. Under other, and I've listed these for you, these would be some things that they don't fit into one of those things, but they're words that you really need to know. Now, the things that I'm highlighting here in my notes and short video are just things that stick out to me as being words that we use often, things that you see often. But you can see already that this is just a partial list from what your textbook also gives you. Gangrene, tinea is a fungal infection, gangrene, death of tissue, albinism, and vitiligo. And then we have a couple of things that there are also abbreviations for, acceptable abbreviations. Abbreviations are usually a shortened form of the word, or a lot of times in medicine it is the first letter of each word, and we use that as an acceptable abbreviation. So BCC is basal cell carcinoma. MRSA, most all of you have probably heard of MRSA. That is a staph infection, but it's not just a staph infection. It is resistant to the normal medications that we give for it. So it is considered, it's methicillin resistant Staphylococcus aureus. So I don't expect you to have to remember or spell out methicillin resistant Staphylococcus aureus, but MRSA I do expect you to know. And it is a infection, a staph infection that is resistant to the normal medication. Psoriasis, scleroderma, SQ with a little q, CCA. That stands for squamous cell carcinoma. So that's a malignant skin cancer. We have eczema. There's lots of terms here that you've got to look at. Some of the surgical related word parts, ectomy, plasty, tome. Those three are kind of the basics. You'll see a lot of words as we go through this text that will use those three surgical term parts, word parts, to indicate what is going on with the person. Ectomy is always going to be to remove something. When we cut it out, remove it. Plasty, think about the plastic surgeon. They are fixing something. They're repairing it. And tome, I'll let you look at that one. All right, cryo stands for cold, cauterization. An I&D is an incision and drainage. Suturing, you know what that is. Debridement, when we debride something that has maybe got some gangrene tissue in it or just dead tissue, we're removing that dead tissue. But as you progress through your reading and exercises in the text, you can see that there are many words that can be formed from just a few skin part words in combination with that basic list that we have. So again, you must memorize the basic parts, and when you get to the chart on page 117, you should be able to identify these words based on the word parts that you have covered through this. So take time to test yourself with all the resources that you have in your text, as well as use the ones online. And I'll talk to you soon.